Hello everyone, my name is Mel and I am the Health and Care Engagement Lead at Canterbury Christchurch University, and my role predominantly consists of raising awareness of all the health and social care professions and support school and college students to progress onto their chosen career in health or social care. I also teach on our professional foundation year. So thinking about all of those careers in the NHS, did you know that the NHS is the 5th biggest employer in the world? Now, when I ask the question of who works in the NHS, the most obvious answers I receive are nurses and doctors, which is of course correct, but there are actually over 350 different roles in the NHS. It's not just about the healthcare professionals. There are also roles that are crucial to the running of the NHS, such as the porters, cleaners, or chefs, for example. The university offered 12 degrees in health and social care, and the next few slides briefly explain each one, including the entry requirements. You will also see in the corner of each, it will indicate at which campus this is taught, either Medway, Canterbury, or both. We also offer a foundation year, which I have the pleasure of teaching on, and this is for those that do not get the grades required for the degree programme. It is also a really good introduction to university for those who want to proceed at a slower pace and spend a year familiarising themselves with university before committing to a 3-year full-time degree. There is new funding of at least £5,000 per year for health and wellbeing students for all of the programmes listed on this slide. It can also be as much as £8,000 per year, depending on your personal circumstances. This money does not have to be paid back. It is there to support you financially whilst you are doing your degree, and it is paid 3 times a year in instalments every single year. There is other financial support also available, and this is in more detail on our website. So when I ask people to think about university and what studying a degree looks like, the answers usually involve stuffy old professors, sitting in lecture theatres all day, and essays. Well, there is some truth in that, although maybe not to the stuffy professor bit. All of our programmes are 3 years full-time, but are 50% placement, which means half of your 3 years will be spent in various placements depending on your programme. So for example, an adult nurse would do a few weeks placement on a hospital ward, then maybe a placement in the community with the district nurses, then at a GP surgery or a hospice. And we find these placements for you and ensure they are as varied as possible. Alongside your placements, a large part of your training will be in our simulation suites, which, as you will see on the following slides, they look exactly like a hospital. This is where you can practice your clinical skills in a fully equipped, realistic clinical or hospital environment. We also have a birthing suite for our midwifery students, an X-ray room, a high dependency unit, and an occupational therapy flat. We are very excited to have our new medical school, which has just opened and is the first medical school in our region. Our health students will have use of the wonderful facilities at the medical school, including the new simulation suites and anatomy centre. Once you have completed your degree, you can have a career that can take you worldwide. Think of a cruise ship, for example. They need healthcare professionals on board to treat people if they become unwell. Before we go on to the next slide, I want you to take a moment to think of all the different roles that you could do if you trained to be a nurse. We often think of nurses working on wards in the hospital, but the following slide will show you just a few of the different roles and the very varied roles that a nurse could do. We've talked a lot about health, but we mustn't forget about social care. This is where you would find the roles of a social worker or an occupational therapist. And as you can see on the slide, there will be 500,000 extra jobs available in the next 10 years and is a fantastic lifelong career. So what do values mean to you? Or we could put it another way. How would you want to be treated by a nurse or other healthcare professional if you had to go into hospital? Following on from the last slide, these are the values that every healthcare professional should demonstrate. If we were in hospital, we would want to be treated with care and compassion. We would want to be treated with dignity and respect. And we would want to know that the person caring for us is committed to giving care and is also competent in doing so. Now, these values are vital, and being able to demonstrate these values is important, especially at interview. We need to know that the students coming onto our health degree programs possess these values. As this presentation has shown you, careers in health and social care are varied, and there are many different exciting roles to choose from. If you are still undecided, then check out this website where you can take a quick quiz and it will match you to roles in health and social care based on your preferences. You may find a role or career that you never knew existed. So thank you for listening to this presentation. If you need any more information, then check out our website where you will find information, advice and guidance on all of our degree programs, finance and student loans, student support and life as a university student. Thank you.